Hey beauties. Today I wanted to do a little post about menstrual pain and heavy periods. A few women in the group have posted about that, and I just wanted to shed some light on that presentation symptomologically. So there's a couple things. First of all, I want to say that I am not a doctor, so I cannot diagnose. If you want a diagnosis for anything, you've got to see a physician. Or an OBGYN. That being said, there's like a set of potential things that's happening if you're having painful periods, clotting, and heavy periods, and dark colored periods. So from a Chinese medicine standpoint, when those things are happening, we are looking at something called blood stagnation. So it's when the blood is not circulating through the organs in the body efficiently and is coagulating. So different reasons for that could be blood deficiency, where there's not enough blood actually, but that wouldn't be a heavy period presentation so much. Generally speaking, liver qi stagnation causes any kind of stagnation type presentation. So stagnant blood, like clots, things like that, indicate that there's liver qi stagnation. The flow of the blood isn't moving appropriately through the tissue. So pain is liver qi stagnation because things aren't moving. When things aren't moving in the body, they create pain. When you have muscle pain, like muscular pain, like say you pull your neck, or you're in pain from working out, your muscles are sore, that is because there's a lot of blood in an area that's not moving through. Now, after you work out, that blood will come and disperse, but a lot of times in my practice as an acupuncturist, I do a technique called gua sha, which some of you who have acupuncturists may have heard of, where we actually physically use a tool to kind of put pressure over the skin and over the muscle tissue to force old stagnant blood out. And then little red dots will come out when that happens. That's the blood leaving the muscle tissue so that new blood and new nutrients can move through. Then the pain will go away. So blood stagnation causes pain. So if you're having cramping, it's usually your body is not expelling the blood that's there. It's having trouble doing that. That's one thing that could be happening. Another thing that could be happening with you if you have clotting and blood stagnation and a dark color blood, like a really dark red, even like a brownish color, or like purple blood, we really would look into potentially you having undiagnosed endometriosis. And there is something called silent endometriosis, that some women have no signs of endometriosis whatsoever. It might be old endometriosis that has since healed, but there's still the presence of that scarring from the endometriosis in your body. So endometriosis, let's rewind, is when uterine tissue has kind of gone rogue and has grown in other parts of your abdomen. Sometimes it grows on your intestines, sometimes it grows on your stomach, sometimes it grows on your fallopian tubes or your ovaries. But this endometrial tissue inside your uterus is growing in other places. So when you have the hormonal shifts in your cycle to your period, all of that tissue responds. So all of that tissue is responding the same way that your uterus is. So it's also feeling pain. It's also bleeding. So that causes a lot of issues. So going back to the idea of what could be going on with you. Small little clots are one thing, but bigger clots are another thing, as well as endometriosis. Well, first of all, endometriosis can't actually be diagnosed unless a physician goes through your skin and through your uterus and actually looks at the tissue in there. That's the only way that you can get an actual diagnosis. So if a doctor tells you, oh, you're fine, you don't have it, but they've actually never done a scope, they can't actually say that to you. And this happens a lot. It's called medical gaslighting. I'm probably going to keep talking about it for a long time because it's so prevalent in the fertility world and y'all have to know about it. That's when something's wrong with your body and your provider is telling you it's not happening. So I urge you to ask your providers to do the tests that they need to do to decide whether or not something is actually going on. A lot of times doctors will be like, oh, you have pain, it's normal. Guess what? Pain is not normal. You should not have pain during your cycle. If you do, there's stuff going on that needs to be addressed hormonally or physically. And just so you know, this stuff is treatable, okay? It's not the end of the world. So most women have some sort of imbalance with their hormones. And a lot of women get pregnant and have hormonal imbalances. So I don't want this to add insult to injury to you and make you freak out more, because that's not what this is about. This is about educating you so you can be an advocate, so you can be fearless, so you can stand up and get to the bottom of what's going on with your body. Don't you want to know? So we've got endometriosis that cannot be diagnosed unless you have a scope, laparoscopic scope, looking at your endometrial tissue. You've got fibroids. Fibroids cause pain. Fibroids cause bloating around your cycle. Fibroids cause that intense bleeding and clotting. You have something called adenomyosis, which is a hardening of the uterine cavity. And that has a lot of similar presentation as endometriosis. You could have a polyp, you could have a cyst. If you're having any of these signs and your doctor has not talked to you about them or really investigated it with you, then you need to find somebody new, because your reproductive endocrinologist's job is to be a detective. That's what my job is for my clients. My job is to be a detective and figure out what's going on. So their job for you is also to be a detective, and they should want to do that. They should want to go and search until they figure something out that's going on with you. There was a woman in the group, I forget who you were, what your name was, who said she was diagnosed with PCOS. And she has all these symptoms of something else. So listen, don't just take what you're being fed from your doctor, especially if you've got symptoms that are going on. By the way, PCOS, you might get heavy periods from it, but the pain and the clotting, that's not typically correlated with PCOS. From my clinical experience, if you're having a lot of blood, we also want to think about, again, thyroid issues. We've talked about this before. Trying to think what else I can talk to you about in regards to this. There are some things that you can do to help this. I talk about it in my course. We go over it pretty extensively. When you have really heavy, painful periods, and when you have endometriosis or fibroids or things like that, anything we just talked about, you have estrogen dominance. Your body is producing more estrogen than progesterone, and we want you to balance those hormones. It's really important that we raise everyone's progesterone who's trying to conceive. We have an epidemic culturally of excess estrogen, and it is because of the toxins surrounding us. And we can totally control that. We can change that impact of toxins around us. We have that ability to. You have that ability to. I teach that in my course. And you have the ability to change your outcomes. So really important, you want to detox your liver. If you have an estrogen-based diagnosis or symptomatology. So chances are, if you have heavy periods, you have that.